So the question is, how common is it for patients that have non-healing foot wounds or leg pain with PAD? So PAD is peripheral arterial disease, and this is atherosclerosis or hardening of the arteries, which affects the leg arteries. Many people are more common or familiar with atherosclerosis, including the heart arteries, which has caused coronary artery disease and heart attacks, or the neck arteries, which can cause stroke. But when that same blockage affects the leg arteries, it's called peripheral arterial disease, and there's a progression of disease. Certainly, you may have some blockage and it's asymptomatic. You may not know it, though it's important to find that out because it's a marker of potential cardiac risk. If you have blockage at one level, you may have it in others, and you need appropriate medical management and evaluation for potentially occult or unrecognized coronary artery disease. However, as the blockages in your legs progress, you get a series of symptoms. The first is called Claudication, named after the Roman Emperor Claudius, who had a limp. When the blockage is such that you have insufficient blood flow when you exercise, you're fine when you're lying around and your muscles don't demand much blood flow, but insufficient blood flow when you exercise, that's called Claudication, and experiences pain every time you start to move as your muscles demand more oxygen, more blood flow, and relieved with rest as that demand decreases. With worsening blockages, you now get what we call ischemic rest pain. And in this scenario, what happens is the blood flow is diminished to the point where you may be okay during the day when you're up and about, but at night when you elevate your legs, you no longer get gravity assisting blood flow across areas of bad blockage. And of course, you're calmed down, your heart rate is lower, and your blood pressure is lower. Now you get inadequate blood flow for the demands of the leg, and you get pain, which can be excruciating and can often wake you up at night, often relieved only by dangling your leg or moving around to help get that blood flow and get gravity to help assist blood flow to the foot. And then finally, in the more severe cases, what we call critical limb ischemia, or chronic limb-threatening ischemia, the blockages in the arteries are so severe that you don't meet the demands of the skin and the muscles, even at rest. And this results in breakdown, or what may happen, particularly in diabetics who have neuropathy, is you get a wound, and now there's insufficient blood flow for healing. And that's the most dangerous situation because those patients can very quickly have progressive wounds and a high risk of major limb loss and amputation, which is where we come in. We specialize in treating particularly the smaller arteries below the knee in diabetics and chronic kidney disease patients, patients who smoke and have other risk factors, to restore blood flow, heal wounds, and alleviate that pain and rest so patients can have a healthy lifestyle.